Mini facelift, a surgical procedure designed to improve early signs of facial aging. When people hit their 30s, maybe early 40s, they notice the jowls, maybe a little bit of a cheek sagging, maybe some extra fold under the chin. Mini facelift can improve all three, lifting the cheek so slightly, getting rid of the jowls, improving the jawline, and getting rid of the neck laxity. How would somebody know if the mini facelift is right for them? Well, there's a very simple test you can do. You can stand in front of the mirror, put your fingers right here around the cheeks and the angle of the jaw, and lift the skin up and back so slightly. Now, make sure you're not pulling very hard and make sure you're not putting your fingers very close to the mouth, because that would not give you a realistic idea of what facelift would look like. So when you lift the skin up and slightly backward and look in the mirror, if you say, oh my God, my face looks so much better, then the mini facelift might be a procedure for you. On the other hand, if you don't really see much of a difference, probably you're not a candidate for this type of surgery. Incisions for a mini facelift. Well, if the neck is included, one small incision is going to go under the chin. Otherwise, incision is going to hide around the ear because it's really the best place to hide them. So typical incision would curve starting around this hair patch, would go inside of the ear on the back of the little cartilage, comes down in this wrinkle, go around the earlobe to the back of the ear and into the hairline. Depending on how much skin we remove, the incisions could be a little longer or a little shorter. That is actually very individual for every patient. What is the best age to get a mini facelift? Well, there's no exact number. Everybody's face is different and there's no specific age when one has to get a mini facelift. But typically, the way the aging process works, people in their 30s, maybe early 40s would be the ones to benefit the most from this type of procedure. What's the best anesthesia for a mini facelift? In my practice, we tend to keep anesthesia to a minimum. We feel like it just makes it easier, safer, and recovery goes quicker. So we typically use two kinds of anesthesia. One is a twilight anesthesia. We do local injections to numb up the face, and we give patients medications to keep them relaxed and comfortable and sleepy. Now, the other type of anesthesia that we use is called deep IV sedation, and this is when anesthesiologist comes in and puts the patient completely to sleep. How long does it take to do a mini facelift? And the number could be different for a different surgeon, but in my practice it usually takes 2.5 to 3 hours. How long does it take to recover from a mini facelift? Well, in my practice, we recommend taking at least a week off work for recovery. And during the first week, of course, it's going to be quite obvious that somebody had the surgery done. But typically by the end of the week, when we take the stitches out, people look quite presentable in public. So bruises at this point fade away to the point where they're easy to hide with makeup. Incisions could be covered with the hair, and the swelling goes down to the point when it's really not very noticeable.